My parents got the call about 1 o'clock in the morning saying your son has been in an accident. What they did not tell my parents is when you get to the hospital, there's every chance that you will not recognize your son.
I was the physician on call for trauma. The report came to me that it was a severe car wreck and the trauma was mainly facial.
The last thing I remember seeing was headlights, but I had no idea at that moment that my sight had been taken just instantaneously.
To have that kind of severity of injury and to not have your brain destroyed was really lucky.
It sounds crazy to say, but the loss of sight was actually secondary. The amount of pain is really indescribable.
This was the most severe fracture I'd seen. These were all just really crushed.
Hundreds of hours of surgery, the facial bones look like a bowl of cornflakes.
That initial surgery, you just know it's going to be a long time, and that took 17 to 20 hours. But that wasn't all of it. We had several more operations to do.
I was at one of my most low and angry and loathsome times. I somehow, in my screwed up way of thinking, looked at he and my other surgeons as they were the ones who hurt me.
Dealing with Marcus's case was perhaps and maybe one of the more challenging cases I've ever dealt with emotionally.
Every time I had surgery, it was just more and more and more pain, and I was just worn out and tired of the pain.
Marcus was in the prime of his life, 18, 19. I put myself in his shoes and just think what you would be doing. You would be outraged all of a sudden, and like that, you're blind and your whole life changes.
Finally, I just realized that this has happened. It's in the past. There's nothing I can do to change the past. All I can do is try to help my future.
What's really amazing about Marcus's story is how he has turned himself from a victim to a survivor.
I have such an incredible life. I never could have imagined as an 18-year-old kid where my life would be today. That crash set me on a path. I never would have thought that I would be writing books. I never would have thought that I would be lecturing around the country, have books that are being used in curriculum for nursing schools. I never would have thought that I would be teaching med students. And it's all based on these horrific experiences that I had post-trauma.
He's a survivor who has taught countless health professionals and patients how to deal with loss and to be better doctors and be better nurses.
When you look at the CT scans, when you look at the x-rays and see the amount of damage that was done, it is a miracle that I'm even alive. But more so than anything, these days, I can eat solid food. I can breathe normally. I can kiss my wife. I can make a living speaking professionally. And the credit for all of those accomplishments has to go to Dr. Jones.